This week on Healthy Living, outbreaks of zoonotic disease raise concern among health experts. And Ghanaian health officials step up efforts to contain the first outbreak of Marburg in the country. Plus, researchers say snail meat consumption may be making you sick. Finally, is your cooked meat safe to eat? Chef Mitchell has some tips. That's in this edition of Healthy Living. Welcome to Healthy Living. Glad you can join us. The World Health Organization has declared the worldwide outbreak of monkeypox a public health emergency of international concern. The WHO's highest level of alert aims to raise awareness on the need for a global response and funding. So far, more than 16,000 cases of monkeypox have been reported this year in over 75 countries. Meanwhile, West Africa has experienced its second outbreak of Marburg virus disease as Ghana has its first encounter with the deadly virus. The WHO says Marburg can be transmitted from animals to humans in circumstances such as hunting and eating of bushmeat. Marburg and monkeypox are both zoonotic diseases, also known as zoonoses. These are diseases caused by germs that spread between animals and people. Ghanaian health authorities say they have ramped up surveillance and other measures to prevent the outbreak of Marburg virus disease from spreading. Here is more.
Ghana has reported cases of Marburg virus in the southern Ashanti region. This is the first outbreak of the disease in the country and the second time in West Africa. The U.S. Center for Disease Control and Prevention says Marburg virus is a highly infectious zoonotic disease in the same family as a virus that causes Ebola. It affects multiple organs in the body and can lead to hemorrhage or bleeding.
Marburg is relatively rare compared to Ebola. They have the same symptoms of fever, body aches, bleeding from all orifices, and and mortality in Marburg seems to be much higher than Ebola. It can go as much as 90%. Whereas Ebola is about up to 50%.
Marburg virus disease can spread to humans from fruit bats. It is transmitted among people through direct contact with the blood, secretions, or other bodily fluids of infected people, and via contaminated surfaces and materials such as clothing. The World Health Organization reports that Marburg can be fatal by 50% on average. However, the rates of fatality have varied between 24% to 88% in past outbreaks. Ghana health authorities say they have implemented measures to prevent the virus from spreading, including contact tracing and strict infection control measures.
The key agencies are in terms of providing PPEs for health workers and other workers in the locality to be sure that should they have any case that they are able to have protection to manage. We are also alerting all health workers to be on lookout. We have what we call primary prevention to ensure that they are not exposed unduly if there are any other cases come. And most importantly, sensitizing their community and people on the presentation of Marburg so that they can quickly identify a report and also avoid contact with such people.
The WHO says previous outbreaks and sporadic cases of Marburg virus disease in Africa have been reported in the Democratic Republic of the Congo, Kenya, South Africa, and Uganda. Angola experienced the deadliest outbreak when more than 200 people lost their lives in 2005. There is no treatment or vaccine for Marburg virus disease at the moment.
For more on Marburg and the emergence of zoonotic diseases, we spoke with Professor Jimmy Whitworth, Professor of International Public Health at the London School of Hygiene and Tropical Medicine.
Well, I think it's quite concerning to have this second outbreak of Marburg occurring in West Africa, because what this shows us is that this disease is extended its geographical range. In Ghana, I think the public health authorities are actually doing a good job. At the moment, this does seem to be contained. If you get infected with something like Marburg or Ebola, you do develop immunity. But it's probably not absolute immunity. It'll wear off over a certain amount of time. And if you get a different variant, then it might be that you're at risk of getting it again. So you get some protection, probably. It's a bit like what we've seen with the coronavirus. As that has evolved, then the immunity that we develop either from natural infection or from vaccination is less effective. It also wanes over time. So you get some protection, but it doesn't last forever. The current monkeypox outbreak is unprecedented. Monkeypox is a disease which its natural home is in Western and Central Africa, in small rodents and squirrels and the like, and people just occasionally get infected. But this one has really spread and really spread fast. The most likely thing here is that it came from somebody, again, who was incubating the infection from Africa, but it got into a close-knit network and was able to spread very rapidly. As far as we know, anybody who is exposed to monkeypox by close contact can catch it. So we're all potentially at risk. Zoonotic diseases are really important, and it sort of brings home that we as humans, we are mammals and we are part of the natural world and we engage with the natural world. If we look at all the viruses that exist and can infect humans, about 2/3 of those we share with animals. Of all the mammal families that there are, then bats are the ones that really harbor the most serious zoonoses. One of the reasons why we're seeing this increase in zoonotic diseases is encroachment into areas where wildlife live. The public health measures that we take to protect the human population must take account of the natural world as well.
In other zoonotic disease flare-up, Tanzania continues to monitor an outbreak of leptospirosis or rat fever, a bacterial infection that experts say spread by rodents. The disease has infected more than 20 people recently in the southern Lindi region, with at least 3 deaths. A report by the WHO concludes that Africa has seen a 63% increase in the number of zoonotic outbreaks over the past 10 years. Dr. Elijah Osati is an internal medicine physician at Muhimbili National Hospital in Dar es Salaam, Tanzania. He tells us more.
After the outbreak, then the Ministry of Health has sent the team to the area, the site. And during that time, they found about 20 people have been infected by the disease and about 3 have died. And others were admitted in the hospital, and the disease was not known. So it was presenting with a severe headache and fever, and some of them were bleeding from the nose, and some also had like convulsions. So right away, the government sent the team, and actually the team took the samples of people who were there, blood samples, and also the team of WHO and CDC also came in, and actually it was found to be leptospirosis. It is different from Marburg or Ebola. We call them hemorrhagic viral diseases, because this is a bacterial one and those are the viral disease. When the leptospira enters into your body, it can go to the lungs. Actually, in the lungs, it can cause bleeding from the lungs, but it also infect the liver. So the patient can also present with we call it jaundice. But also it can go to the kidneys. Again, it can go to the brain and can cause meningitis. It is more similar with dengue fever, before the team went there, about 20 people were found to be infected, and 3 of them died. So currently, the remaining patients have been cured and allowed to go home, except 2 whom were still in the hospital, but they are doing fine. So, after we realized that it is leptospirosis, and then started treatment immediately, because only just antibiotics can cure the disease. So the situation is not bad, it has been contained, and the surveillance is also continuing around the area.
The WHO says zoonotic diseases, including monkeypox and Marburg, can be transmitted from animals to humans in circumstances such as hunting and eating bushmeat. What are your thoughts, and what can be done to address the issue when bushmeat consumption can be cultural? Here are some reactions on Facebook. Mamadou Falilusek says, food consumption habits are very diverse in Africa, and this could explain the recurrence of certain epidemics in some regions and not others. In Senegal, for example, the consumption of bushmeat is very rare in urban areas, and epidemics such as Ebola and COVID-19 have heightened people's mistrust of bushmeat. Hakibu Demonjega writes, "This will not deter us from eating our bushmeat." In a new report published in the journal Emerging Infectious Diseases, researchers say snail meat is likely behind some disease outbreaks in those African countries where snails are eaten. The researchers assessed the prevalence of potential foodborne pathogens in land snails consumed in Bueha, Cameroon. They detected at least 1 pathogen in every sample examined, and most contained multiple pathogens, including Listeria and Salmonella. African land snails are a source of food for many in some regions of the continent. Snails are consumed worldwide. According to the scientists, the results show the public health risks in the handling and consumption of raw or undercooked edible snails collected from natural habitats in Cameroon. Experts say many different types of bacteria can grow on animal and seafood products. Therefore, it is important to safely handle them and cook them at a right temperature. Michel Moulin-Kazadian is a chef and fromager in Syracuse, New York. He shares some tips.
The first thing you want to do to see if your meat is any good is use your eyes and just check to make sure it's the right color. The chicken should be a nice pink off-white color like this. It shouldn't be green or any other color really. Red meat like beef should be a nice deep red color. Again, no discoloration. If there is any discoloration like gray, then that's when you want to give it a smell and make sure it doesn't have any strong odors. Same with the lamb. It should be a deeper red with no discoloration, with no strong odors. The fish should be the same. For salmon, you're looking for a pink orange color, no green or gray, and it shouldn't have any strong fish smell. It should have like more of an ocean smell. The chicken, we're going to pan sear. I like to go kind of heavy on the za'atar spice. The safe cooking temperature to make sure there's no E. coli or food poisoning. For chicken, it needs to be 165 Fahrenheit. For beef is 145. Same with the lamb chop. For fish, 145. To get rid of bacteria like E. coli or salmonella. When taking the temperature for your various meats that you're cooking, you always want to get into the center of the thickest part.
Good.
Mm-hmm.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voanews.com or voaafrica.com. You can follow me on Twitter at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.